Along with insulin sensitivity, there's often dyslipidemia or cholesterol issues. So when we look at her cholesterol panel, her total cholesterol, 307. Okay? Her medical doctor wants her on a statin drug, and we're saying, why do that? Why not address the cause? If we address the cause, then you don't need the statin drug, and we'll show you that. Her LDL was elevated at 233. Lab high, okay? Quite high. Her triglycerides, we said, were 141. Her apolipoprotein B, or ApoB, which we've talked about on this channel as the best cholesterol marker for cardiovascular disease risk, was very high at 177. Okay, we'd like that to be low 80s ideally. So regardless of what the standard lipid panel is, the ApoB says she is at increased cardiovascular risk, just that number alone. And then one other marker, lipoprotein little a, which is an independent risk factor for heart disease itself, that was lab high as well at 219. So she is a cardiovascular risk patient, regardless of what her total cholesterol is, because of these numbers, because of the inflammation related to insomnia, the metabolic dysfunction related to insomnia. So not looking good. How did that impact her lipid panel? Her total cholesterol went from 307 to 185. Now, the typical medical doctor that would have been throwing statins at her earlier would be loving that number. Her LDL improved from 233 to 126. Again, an optimal number for her age if you're looking at research that is looking at healthy people. Her ApoB, massive reduction, down to 92. Okay, remember the goal is low 80s. She's almost there, but from 177 to 92 is a massive, massive drop. Okay, what's that? 77 plus 8, 85 points down, almost a 50% reduction. No drugs. And then her LPA had dropped to 132, which is a huge drop as well. And the LPA is a marker that often has genetic contribution to it. So it's possible that she has some a genetic variant that's contributing to her number being high. And so if that's so, we need future data points. But if that's so, then we just adjust what is optimal for her. So we take what's the lowest number we've ever seen for her, and we base improvement or flares based on that. So massive reduction in not only lipids, but in cardiovascular disease risk, which is the #1 killer. So obviously improving that is very important clinically.